Sometimes in some countries you just have to make people aware of the fact that what is family planning and what are the options that are available. But I think we've passed that time. We're also past the time when we are just talking about controlling families. I think we don't talk about population control at all anymore. We really talk about, making sustainable, access to family planning more possible for people, especially the poor and especially women. So in a sense, from population control, which often was what people talked about, we're not talking much more about access to contraception. That's really our focus. And in fact, our mission statement mentions that our focus is to make sure that everybody has access to family planning, but essentially that all pregnancies are wanted. That is really a core part of our mandate. Well, the good news is in terms of the Millennium Development Goals, while they did not include family planning per se, in a sense we have had a very major opportunity that has walked our way through the World Summit, where it was agreed, the world leaders agreed, that they would actually include universal access to reproductive health care in the target, as a target within maternal health care. So the good news is that when the Millennium Development Goals were agreed, you didn't see explicitly reproductive health care, you do see it now. And there was agreement earlier in the year that it would be a part of maternal health care. Now, reproductive health care is very broad, but it gives us the opportunity, therefore, to look at family planning as one of the indicators of good reproductive health care. So to some extent, I would say that it may have seemed like we'd lost the battle, but we haven't. We really have managed to get it even in a broader framework in terms of universal access to reproductive health care, where family planning is a component. But we want to make sure that family planning continues to remain high. And that's the kind of nuanced advocacy that we will have to do, because we don't want any of the elements of reproductive health and sexual health to be lost. That we run the risk. So the nuancing of that message is really, really important. That's the first thing. And the fact that also get out the information that it's not finished. The agenda is huge. A lot of people think, oh, family planning, done. It's been done. It's, accessible to developing countries. It's available. Reproductive health commodities, just, having contraceptive commodities available to people in crisis, people in conflict, is a major, major problem. But even where countries are in a stable condition, often they do not have the facilities to store, the facilities to distribute. They don't do costing, they don't do projections for their needs. And all of that UNFPA would like to help them for. So we're trying to take a sort of a broad approach on different elements. Funding, commodities are two that we know we'll definitely focus on. But of course, our advocacy will be on access.